If you are suffering with headaches or upper neck pain, then this video is for you. We're going to go into several exercises you can do to help reduce or eliminate your headaches or upper neck pain. In other videos, we go into the difference between a mechanical headache, things that come from the mechanics, as well as something that is not mechanical. So just real quick on just kind of summarizing that a little bit. If you are in a prolonged position and that is something that gives you those headaches or those upper neck pains, such as I'm a dental hygienist, I've been looking down, by the end of the day, I really hurt on the weekends, I feel much better because you're not in those positions. Those are kind of things that we look for to go like, yep, there's a mechanical issue in there. Other things is if your neck is stiff and you notice it gets stiffer along with the headaches, those again, that's when we kind of start looking in the mechanical pieces of it to help reduce those headaches or take them away. Other things are like pain location. So if you're having pain location, like, yeah, I get pain here and I get pain up here, more than likely there's something going on in the upper neck. And then the other one is massage, chiropractors. Those feel good, but the pain comes back again. And a lot of times it's because we've got to teach you what you can do because this has been going on for a while. A lot of the joints are super stiff and we actually have to stretch those joints, which we're going to show you today. And when you do a chiropractor, they adjust it and it comes right back again. If you do a massage, you're treating the symptoms of the soft tissue, but you aren't addressing the mobility issue that is lacking. And so the big areas that can give you headaches, and people don't think about this, so upper cervical is definitely one, even into a little bit like, C1, C2, but also the first rib. The first rib can also provide headaches because all the muscles attached down here also go up in here, and it's often missed by most healthcare providers. So we're going to show you 4 exercises you can do to reduce headaches. Now, everyone's a little bit different on what works with them, so you're going to have to play around with it a little bit. But a lot of times what happens is the upper cervical joints are really tight. They're not moving. And we're going to show you a stretch that you can do that's going to work on both sides. It's going to stretch both sides at the same time. Now, if this exercise that I'm about to show you is like, ooh, that's kind of making me feel a little bit worse, then you'll want to do the next exercise that we're going to show you. So this first exercise is going to be, you're going to be on your elbows, on your stomach. And what you're going to do is you're looking at your hands because it keeps your head in a good head position. And you're going to basically come in and it's like someone's going to come in for a kiss and you're like, no. That's the exact motion. Everyone does it correctly when you do that. So you'll come in for a kiss, no, and then you want to hold the chin and then just breathe and hold. And just relax. So you're wanting to feel your chest kind of come down as you're getting pressure to move the joints up a little bit to really stretch that joint. Headaches respond really well to sustained positioning because again, usually it's the joint is so tight, we've got to stretch it. And so stretching it is that sustained position to get that joint to open up. Now, when you do this, you're going to want to hold it a good 2 minutes, 3 minutes. And you're going to want to do this, 3-4 times throughout the day. Holding that position, 2 minutes, 3 minutes type thing. It needs to be a prolonged hold. If you're noticing that is like, ooh, that's kind of making me feel a little bit worse. Not the first time, go and do it a couple of times to see, because sometimes you're super stiff at the very beginning and it can make you feel like, ooh, I don't know if this is really, if this is feeling good or not. So do it a couple times and just see. And if you're noticing that it's repeatedly kind of not making you feel good, then you're going to want to do this other exercise. If you notice you're not feeling good the first time, but the second time you're starting to feel a little bit better, then and continue it on, you continue to feel a little bit better, then you're going to want to do this. The reason why you want to do this, doing this exercise 3, 4, 5 times throughout the day is because what happens, we're super tight and that joint will want to come back, and then we stretch it again and then it wants to come back and then we stretch it again. And so we're just trying to maintain that mobility. And when it's been like this for a while, it's going to take repeatedly doing it day after day after day after day until the body goes, okay, now it's really moving. Now you're feeling really good. So that's the first exercise that you want to do. So again, if you aren't feeling good with this after doing it 2, 3, 4 times and you're noticing like, no, I'm feeling worse, or as you do it for like a whole week, you're noticing like, I'm not noticing any changes, then go and do this exercise. Sometimes we're just tight on one side. Now there's other videos where I show people if we bring the head up and we rotate, we can tell like one side won't move as well as the other side. And so when we notice things like that, we will try to go into a little bit of retraction like what I just showed you here, but oftentimes we have to go and move in more of a lateral direction, and that's what we're going to show you today. So if you're noticing you're tight over here now, I'm just going to give you a caveat. When we test you, sometimes people are like, wow, I can't move here, but their pain's over here. And sometimes they can't move here and their pain's on the same side. And so just because of where your pain is located, sometimes the mobility is on the opposite side and sometimes the mobility is on the same side. So again, really getting in with someone that understands and knows what to do is going to make a big difference, because if you just go on the pain side doing this, you may be going in the wrong direction. So you may try it on one side and then you may try it on the other side. And again, you can, coming in for us to do evaluation will definitely help you speed up this process a lot. So this exercise to really stretch the upper joint, and we're going to do it on this right side, and we're going to go on one side. You're going to basically take your hand on your head and you're going to side bend. You want the ear to go to the shoulder. You're going to side bend. So you're going to hold that and then you're going to rotate. So side bend to the left, rotate to the right. This is going to stretch the right. And so you just go hang out there and breathe, and you'll feel some tightness up in that area, and you just, again, you want to hold it for 1 minute, 2 minutes, 3 minutes. The holds are the key, and what you'll notice is that'll start opening up that one side that is giving us a lot of problem. These are mobility exercises because, again, if you're not moving correctly, then your muscles will tense up and protect, which is why the massage does not always work, because we have to get things moving. If they're not moving, then you're going to have a problem. So those are the two exercises that are our go-to exercises for when we have headaches. Now, there's some other ones that can be a little bit more complicated, but those are the normal ones that we see day in and day out. Now, if you have issues in this first rib, this also can be giving you some headaches. And how we know is because we assess everything. We assess how your upper neck moves, we assess how your middle neck moves, which moves very different, and we assess how the ribs move, we assess how the lower neck moves. And so when we're assessing all these things, we're like, wow, tight here, tight here, tight here. So we want to address all those areas. Oftentimes when we mobilize in this area for that first rib, they'll be like, oh my God, that is producing my headaches. And you'll hear that. It doesn't happen as often, but it does happen. So if you're noticing you're getting some tightness through here and you're just always feeling like you want to bring the arm back because you're always just trying to get some relief, and that's tight and it's creating, and you're having headaches, you're going to want to do this exercise. So this is just a Theracane, and what you're going to do is you're going to put it on the top part of it. There's like a meaty area, and so you're going to hit that top part, and then you're going to use your hand to pull down. So I'm pulling down to just kind of mobilize that first rib. And usually on this one, what I do is I just kind of do a pressure on, pressure off. Pressure on, pressure off. You can also hold it. If you hold it there for a while, it's a way for you to increase the force through there, but you're just trying to get that first rib to move. And when you do this, you may notice like, oh man, I'm feeling it in my head. Very normal, happens. Then you know that that's where a lot of your pain is coming from, your ribs. And as you mobilize that, it gets better and better, and then the head pain goes away. So those are 3 mobility exercises. Now we have patients where we go in and their range of motion looks normal. Like we can't reproduce it. They have normal range of motion, or we have clients that we've worked on. Their mobilization looks really good. Everything is moving, but they still will get some tightness. And the tightness is just a little bit of muscle tightness, but that muscle tightness over time will then work on tightening that joint. So we use a thing called a suboccipital pad. These are amazing. They have little ridges, and these little ridges we're gonna put on the top of our head. So you're gonna lie on your back, and you want this to go on the top of your head. So kind of what I do is I will push down my head, and then I'll move my body oops, it moved a little bit. I'll push my head down and I'll move my body down. So when I do that, it's like you're going into that suboccipital area and then you're pulling on it to give you good traction. So you're gonna get traction in the joint, but you're also gonna get those muscles to kind of relax as well. So you kind of are doing a little bit of a mobilization and you're kind of pulling away to get a little bit mobilization as well as getting some of those muscles to release at the same time. Now, there's times when you can be tight on one side. Remember, like you want to side bend, rotate, you only have tightness on one side. I will just then push more on that side to really work on getting that area moved. And you can work your way down a little bit to where you go into a little bit lower, doing kind of the same thing. Push down, rotate, or not rotate, slide down a little bit. It's just a little small movement. You can see my body. I can push down and you can see my body just moves this way a little bit to kind of help mobilize it. You can, again, hang out here for 2, 3, 4 minutes and do it, 2 times a day or so. And you'll notice when you come up, everything's gonna feel lighter. This one I like the best because it has a lot of little ripples. There are ones that are out there that have big bumps. I don't want the big bumps. I want the little ripples. So this is, again, called a suboccipital pad, and you can find these on Amazon. So there are the 4 exercises that you can do if you have headaches. And again, we have other videos where we're going through evaluations, showing you what we find in people, as well as our top 5 tips, showing you that these are the things that we look at to determine if it's a mechanical headache. So there's other videos out there on those, so make sure you check out that. Subscribe to our channel, like this video, comment below if you have any questions or concerns, and share your story as well. We're here to help you understand the body better, because we always say where the side of the pain is often not where the source of the problem's coming from, and we have to look at a lot of different areas sometimes to get to the source. And our goal here is to kind of help you understand the body a little bit better. So we'll see you next time.